Dr. Ken Landau. Thanks for watching. Let's talk about Contrave. Contrave is a new pill from Orexogen Therapeutics. It's a drug that helps you reduce your body weight in combination with diet and exercise. So far, sounds good. It's a combination of two active ingredients. One is bupropion. That's also better known as Wellbutrin or Zyban. Helps you stop smoking and helps as an antidepressant. And naloxone helps if you're addicted to narcotics or if you want to get off of alcohol. Now, there's limited evidence that either component helps with weight loss. But in 2014, the Food and Drug Administration was convinced by Orexogen that this ought to get licensed. But it's licensed only in addition to diet and exercise, and only for people who are obese, defined as a body mass index of more than 30. You can find out how to calculate your body mass index by just going to Google, type in BMI calculator. So if your BMI is more than 30, or if it's more than 25, that means you're overweight. If you have at least one additional risk factor for cardiovascular disease, maybe diabetes or hypertension, or maybe you have a high cholesterol. Now, the naloxone component was originally approved in 1984. That was for opioid addiction. And the Wellbutrin, or bupropion, that was released the following year, 1985, for treatment of depression. The method of action, well, supposedly, bupropion helps cut your appetite, maybe because it treats your depression, and naloxone seems to block some addictive behaviors. And maybe overeating or compulsive overeating is an addictive behavior, maybe like kleptomania or hair pulling or gambling. So the two of them supposedly work together. Now, the mechanism of bupropion is it works in the brain on an area known as the hypothalamus. And it seems to have something to do with your appetite control centers. But it releases a chemical that blocks the loss of appetite. So the naloxone, that blocks the chemical that blocks the loss of appetite. So altogether, the two drugs are supposed to be wonderful because they complement each other. Well, the question is, do they really work? It's advertised as the #1 weight loss drug in the United States. But you have to realize that 50% of the people, half of the people who take the drug, don't even follow through with the drug. And in a quarter of the cases, 25% of the people stop because they have a side effect from taking the drug. Now, how much weight do you lose if you take the drug and you stick to your diet and your exercise? Well, in a study, it was shown that over the course of a year, people who took the diet and the exercise and took the Contrave 2, they lost about 12 pounds. The people who would diet and exercise lost only about 3 pounds. Now, if we look at people who lost 5 to 9% of their body weight, how successful was the drug? So let's say you weigh 200 pounds. What's the likelihood of your weighing 190 pounds or less after a year of the drug? 20%. That means that 80% of the people couldn't even lose 5% of the body weight. And as a matter of fact, half of the people who took the drug had either minor weight loss or no weight loss at all. According to the FDA, if you've been taking the drug for 12 weeks and you haven't lost 5% of your body weight, you ought to get off of the drug, which means most of the people would end up not taking it. Well, what is a BMI? So if you're 5'9", a BMI of 30 means you weigh about 200 pounds. A BMI of 30, if you happen to be 5'6", means you weigh about 185 pounds. So you have to weigh that much to take the drug. But remember, the drug doesn't work too well anyway. And if you take the drug, you can take it with meals. But you can't take it with a high-fat meal, because if you take it with a high-fat meal, it'll be absorbed to a great extent, and then you might have a seizure. Well, in order to reduce the chance of seizures, the way the drug company says that you should take the drug is the first week you take 1 pill with breakfast. Second week, you take 1 pill with breakfast, 1 pill with dinner. Third week, 2 pills with breakfast, 1 pill with dinner. Fourth week, you take 2 pills in the morning and 2 pills in the evening. But if you happen to have kidney disease, you can only have 2 maximum. And if you have liver disease, you can only take 1 maximum. And remember, half of the people stop taking the drug before the end of the trial, and about 25% of the time it's from side effects. Well, what kind of side effects? Lots of side effects. Nausea, 1 person in 3. Constipation, 1 person in 5. 1 person in 10 will suffer from vomiting or headache or dizziness or dry mouth. You have a change in your taste. You have an increase in your heart rate, an increase in your blood pressure. People taking the drug also suffer from agitation and sweating and anxiety and trouble concentrating and tremors and hot flashes and insomnia and ringing in the ears and abdominal pain and diarrhea. Well, you shouldn't take the drug if you have uncontrolled high blood pressure, or if you have seizures, or if you have anorexia or bulimia, and if you're discontinuing abruptly from excessive alcohol use. And you shouldn't take the drug because of the naloxone if you're taking an opioid, drugs like oxycodone, hydrocodone. You should be off those for at least 7 days, and if you were taking methadone, you should be off that for 14 days, and you shouldn't be taking an MAO inhibitor for depression. And if you take diabetic medicine to reduce your blood sugar, you have to be careful because your blood sugar might fall to very low levels, and it might even cause a skin disease, potentially fatal skin disease, where your skin blisters and just falls off. We call that the Stevens-Johnson syndrome, or anaphylaxis. And it can potentially cause fatal liver disease. And if you happen to be taking Plavix, it'll increase the concentration of the bupropion, or the Wellbutrin component. And if you take the bupropion, it's going to increase the concentration of the antidepressants, the tricyclic antidepressants, the older antidepressants, and newer SSRIs like Prozac and Paxil. It's going to increase the concentration of antipsychotics and beta blockers. It's going to increase the concentration of metformin and Chantix even. And then if you happen to have Parkinson's and you're taking levodopa, it's going to cause some neurotoxicity, and it's going to decrease your risk of having, it's going to increase your risk, decrease the threshold of your having a seizure if you're taking an antidepressant, or if you're taking a steroid, or if you're taking an antipsychotic. And you have to be careful if you drink any alcohol. Well, there's a black box warning on the drug, and it says that it can increase your risk of suicidal thoughts or actually committing suicide. It leads to seizures, of course, and acute angle glaucoma, and it can lead to liver disease. Now, Consumer Reports says, hey, this is not a miracle drug. After taking the drug for a year, you're going to lose 5 to 9 pounds more than you would if you took a placebo. That means about 1 pound every other month. And that's after you consider the diet and exercise. Well, now here's where the interesting story comes from. That wasn't so interesting, but here's the interesting part. Well, because the drug might cause an increase in your heart rate and your blood pressure, both systolic and diastolic, when it was originally submitted for review by the Food and Drug Administration back in 2010, the FDA said, hey, we've got some concerns about the cardiovascular safety of this drug, and we want you to do a study before we'll approve it to show what the risk is. The company said, nah, that's not necessary. They disputed the FDA findings. The FDA in 2011 said, no, you got a problem with the blood pressure, it's increased. You got a problem with the heart rate, it's increased. We want a 9,000-person study to show whether this is a safe drug or whether it's not a safe drug. We want you to study some people who were at high risk. So originally, the study was going to be done in 2017. But unfortunately, when the study was done, when the study was 25% completed, the company found out that the short-term results showed a 40%, actually 41%, reduction in what we call the MACE, major adverse cardiovascular events. So the rate of death of heart attacks and strokes after 25% completion was 41% reduced in people who took this drug. That's amazing. Cholesterol-reducing medicines won't do that. Aspirin won't do that. Plavix won't do that. And as a matter of fact, this drug won't do it either, because when the study was 50% complete, actually, the results showed that it was no different than placebo. And in fact, between the 25% and the 50% completion marker, there were more people who had cardiovascular events in the group taking the drug. Well, the company wanted, because they saw the 41% reduction, the company wanted a patent. So there was a lot of news and stories about this 41% reduction. They did get the patent as a preventive agent for cardiovascular disease, but actually 50% completion showed no difference. 64% completion of the study, again, showed no difference. Actually, the people taking the drug had a little bit more of the non-fatal cardiovascular disease, the non-fatal heart attack and non-fatal stroke. So the guy who was leading the study, Dr. Steve Nesson, said, hey, this is supposed to be all confidential material. Here you're going out and you're talking about the drug and you're making mention of this 41% reduction that turns out not to be true. So we think the study should be stopped. And indeed, the study was stopped. And now they have to do a new study, and the new study isn't going to be completed until 2021 or 2022. Well, originally the company was using another drug company known as Takeda Pharmaceuticals, to help as a partner with them. But Takeda said, hey, you're messing up, so we're leaving. We're not going to have anything to do with you. Now, the study is going to cost them $200 million about. And since Takeda left, remember we said that this is the #1 drug in the obesity-treating family? Well, the reason it was the #1 drug is that there are a lot of drugs out there, so the market is heavily fragmented, and Takeda had 900 sales representatives. So they were out there hawking the drug to all the doctors. That was why it was #1. Now, the Contrave doesn't have that. They only have the Orexogen 160 drug reps. So as a result, the profits are falling. They don't even expect to be profitable until about 2018. Sales are down. And we don't know whether this is a safe drug for cardiovascular health or not. And unfortunately, since it's proclaiming itself the leader, in the drug business, when somebody's the leader, you think of hundreds of millions or billions of dollars of sales. Well, this one had a paltry $53 million in sales. And worse yet, they're co-marketing the drug in Europe with Valiant Pharmaceuticals. That's also a tainted company. They have lots of problems. Well, it's important that you understand that at the present time, since the company has gone through this sort of bad time, we don't know whether it's a safe drug as far as your heart is concerned or not. But we do know that the drug is expensive. If you pay cash for the drug, taking the full dose, you'll pay about $8 a day. And if you have a savings card, you can reduce that to maybe $1 to $3 a day. But in summary, my thoughts about the drug are, it has a very long list of very important side effects for a drug that might be associated with an extra 1 pound weight loss every 2 months for about $3,000 a year? Give me a break. Actually, I'll give this one a thumbs down. And some people might even say it's a ripoff. I'm Dr. Ken Landau, and thank you for watching.